Hello, this is Dr. Grande. Today the question is, what is selective mutism? Now, selective mutism is an anxiety disorder, and it's similar to social anxiety disorder. It primarily affects children, and it's characterized by not speaking in particular situations.
This seems like a difficult disorder to diagnose. Can it be mistaken by any other disorders?
This is a difficult disorder to diagnose because it looks so much like social anxiety disorder. And you have to be careful in diagnosing this to make sure that the individual doesn't have another disorder that better explains these symptoms, like schizophrenia or autism or communication disorder.
How is selective mutism diagnosed?
So this disorder would need to be diagnosed by a mental health clinician, and they would use an assessment. They would go through and talk to the child and get a history of the symptoms, maybe talk to the parents. And they'd also use various assessment tools. Most of these would be self-report. So this is where the child would just simply fill out the form and it would be scored by the clinician.
And what is the prevalence rate for selective mutism?
This disorder is relatively rare. We believe it affects less than 1% of the population. And most of these individuals are preschool age.
I hear the word selective. What exactly does that mean? Are they usually mute? What causes this behavior?
Right, so think about the term selective mutism, the disorder. Yeah, it does have the word selective in there. And what oftentimes happens with this disorder is the child, assuming it would be a child, of course it can be an adult, but the child could communicate very effectively verbally at home and would actually communicate within normal limits there. But in another setting, like school, they would not. So that's one popular division. We can also see other things happening though. Sometimes the child is able to communicate with teachers, talk to teachers, no problem, but peers, classmates, that would be a problem. Another situation that occurs with this disorder sometimes is the parent's reaction can accidentally extend the symptoms. They can reinforce the symptoms. So when the child's not talking, they might instead resort to something like pointing or whispering. And instead of trying to seek treatment or otherwise address the symptoms, the parents will communicate for the child. And this ends up being a reinforcement that can actually make things a little worse. So it's important to seek treatment when you see the symptoms of this disorder.
How is selective mutism treated?
So this disorder can be treated in a variety of ways by mental health counselors. The first way would be cognitive behavioral therapy. That's a popular treatment, and that's particularly effective in children that are 7 years or older. Another popular method is shaping reinforcement. So you remember earlier when I was talking about the accidental reinforcement that can occur sometimes with parents. Well, counselors can use positive reinforcement in the form of rewards to encourage speaking behavior that they would want. So that can encourage the child to speak and start to reduce the symptoms of the disorder. Another method is self-modeling, and this is a method that involves some technology where a counselor will ask the parents to record the child speaking, and this is under the assumption the child can't speak in the therapy session, and the counselor will play that recording. So it becomes a self-modeling, just like the term reads. So the child will see themselves on the screen, and they'll learn that behavior. Another method is systematic desensitization. This method is used for a lot of disorders. In the case of selective mutism, the way we see this used a lot is to take an area where the child is successful with speaking, again, primarily at home, they would be around family, and introduce a stranger, somebody like they might run into in public or in school, and slowly add different people or more people until the child becomes comfortable with that. And there are some medication options available as well. These medications can reduce some of the anxiety symptoms and allow counselors to be more effective in their work trying to overcome these symptoms. So it's important to remember from the counseling side that we don't want to make things worse for the child. So with methods like systematic desensitization or reinforcement, if these aren't used carefully and gradually, they can push the child into more negative behaviors, into not talking as much. So it's important to, as I mentioned, introduce them gradually and do frequent assessment to make sure that you're actually making progress in reducing the symptoms.